How can you boost your immunity to fight COVID-19? With COVID rates going up, it's only a matter of time before we get infected with COVID-19 again. There are very few people who have not yet been infected by COVID-19, but this time around, with no masking, no distancing, no precautions, it's very unlikely that anyone will be able to escape getting infected with COVID-19. Many of us will get infected multiple times with COVID. So now is the time that you need to be thinking about boosting your immunity to fight COVID, and by the end of this video, you'll have had a masterclass on how to boost your immune system. I'm an Indian origin, England-trained, Canada-based physician, currently enrolled on a postgraduate certification in nutrition at Harvard. For starters, I'd like to explain to you that the claim of boosting your immunity in most cases is a spam. There isn't really any way that you can boost your immunity. A healthy immunity lives within a healthy body. Of course, there are certain factors which are not modifiable, including advancing age. With advancing age, just like our vision and our hearing gets weaker, we do develop some degree of immune senescence, which means an aging immune system. After the age of 40, our thymus gland becomes less active, so not identifying new pathogens as quickly as it did before, which is why advancing age has been identified as a significant risk factor for severe outcomes of COVID-19. So medically, the only way you can really boost your immunity against COVID-19 is by getting a COVID-19 vaccine. A vaccine gives your body a teaser of the virus, and this allows your body to produce antibodies which are ready in storage for when the virus actually comes. The new XBB 1.5 variant targeting COVID-19 vaccine booster has now been licensed and will be available soon. I would urge all people to get their flu vaccine and COVID booster at the same time at their local pharmacy once this becomes available. This is available 6 months of age onwards, and the only real contraindication is if you've had a COVID infection or vaccination within the last 6 months, or if you've had a previous severe allergic reaction to a COVID vaccine, in which case you may have to wait for one of the alternatives. As an example, the protein subunit based Novavax vaccine will also be licensed and available. Of course, there are lifestyle and nutritional ways of boosting your health and immunity, and here I would like to introduce Professor Beth Grates at Harvard Medical School, also president of the American College of Lifestyle Medicine, a truly inspirational and motivational teacher and leader. This is an editorial that Dr. Grates had published, in which she makes the case that the leading comorbidities for COVID-19 include hypertension, diabetes, high cholesterol, and heart disease. And this is why improving nutrition, activity levels, sleep, and stopping smoking can be considered as lifestyle interventions to prevent severe COVID-19. This chart shows the top risk factors for COVID-19 severity, including high blood pressure, diabetes, high cholesterol, heart disease, and kidney disease. And lifestyle interventions, including the DASH diet, for example, have been shown to reduce blood pressure equivalent to a medication. Certain variations of the DASH diet, as an example, reducing carbs further and replacing those with healthy fats more akin to a Mediterranean style diet, have been shown to reduce blood pressure even more. In fact, intensive lifestyle modification has been shown to even cause regression of blocked arteries, as was described in this lifestyle heart trial. In this study, over 5 years, the mean coronary artery blockage increased from 41% to 52% in those who did not do intensive lifestyle intervention. However, in those doing intensive lifestyle intervention, the blockage reduced from 41% to 37%. Over the 5-year period, cardiac events were twice as likely in the group not doing intensive lifestyle change compared to those who did. The OmniHeart randomized control trial sought to understand which kind of food substitutions need to be made to replace saturated or bad fats for best cardiac outcomes. Their finding was that in addition to reducing saturated fat, also reducing carbohydrates with either protein or monounsaturated fats would lower blood pressure, improve cholesterol levels, and also reduce the estimated heart risk. So moving more towards a Mediterranean style diet. Dr. Beth Grace goes on to explain that the second week COVID-19 complication or worsening is characterized by an increase in inflammatory cytokines. Patients get an increased CRP and interleukin levels, which is then very difficult to control and starts affecting the organs. It is postulated that the reason that obesity, diabetes, blood pressure, heart disease are risk factors for that happening is because they already have increased levels of inflammatory markers in their body. So markers such as CRP, ferritin, interleukin 6, etc. It is the excessive inflammation which eventually leads to blood clotting, organ damage, etc. And anything you can do to reduce your baseline level of blood inflammation would be helpful if and when you were to contract COVID-19. Nutrition, exercise, and sleep also play a vital role in supporting our immune system. Eating foods rich in micronutrients such as vitamin D, vitamin E, zinc, as well as omega-3 fatty acids improve immune function, as does vitamin C. Getting adequate amounts of vitamin D can be challenging, particularly as winter approaches. And apart from supplements, various beverages and foods are fortified with vitamin D, such as milk, soya milk, certain legume and nut-based beverages as well. Dietary sources of omega-3 include fatty fish like salmon, trout, sardines. Walnuts are also a good source of omega-3. Shellfish, legumes, nuts, seeds, and eggs are good sources of zinc. Vitamin E is found in nuts such as peanuts and almonds. Ultimately, a plant-predominant food choice with some element of a Mediterranean diet is the best for your immune system. This is a study in which all these nutrients were tested for their effect on the immune system. And this is a really interesting table within the study showing what effect these nutrients, including vitamin D, vitamin E, zinc, polyunsaturated fatty acids, probiotics, and EGCG have on various types of immune cells. Vitamin C is also an essential nutrient for immune function, and of course, the best source for this is fresh fruits and vegetables. Quality uninterrupted sleep over 7 to 8 hours for adults also optimizes the immune system. This is a study which investigated the association of insufficient sleep with respiratory infections. And in this study, subjects were sleep deprived and then exposed to a virus. Both studies confirmed that reduced sleep duration was associated with an increased risk of getting respiratory infections. There is also evidence that a brisk walk for 30 to 45 minutes increases your T cell function. The relationship between physical exercise and a good immunity was confirmed in this study, in which the activity of various immune cells was increased after periods of acute exercise. This study, published in JAMA, found an inverse relationship between the step count of a person and their risk of dying of any cause. And their conclusion was that increasing the number of steps you walk in a day is a simple way of increasing your life expectancy. With COVID rates rising, now is the time to boost your immunity by getting vaccinated and also by following a healthy lifestyle. Remember to share this video with those who you care about and follow this channel for more updates.
Follow Eastern Values Weight Loss.